Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about liver cirrhosis. When cells are injured or damaged and die off, usually the dead tissue that was previously full of living cells becomes fibrotic, meaning it becomes thickened with hips and hips of protein and forms scar tissues. So when your liver is constantly forced to process alcohol, like an alcoholic liver disease, or subject to a viral attack for long, like an HPV, or anything else that causes a long-term or chronic state of liver cell or hepatic destructions and inflammations, the liver could become seriously scarred and damaged to the point where it's no longer reversible, at which point it becomes fibrotic, and in the liver we call this process a cirrhosis. Because it's usually irreversible, cirrhosis is often referred to as an end-stage or late-stage liver damage. When livers are injured, they start to become together and form what are called regenerative nodules. You can think of this as the colonies of living liver cells. And these are one of the classic signs of cirrhosis and why cirrhotic liver is more bumpy as opposed to smooth, healthy liver. Also, with cirrhotic liver tissues, you'll see that in between these clumps of cells or nodules is the fibrotic tissues and collagens. Here's a classic histology image of a cirrhotic tissue. This clump of cells in the middle is the regenerative nodules. And these blue stains surrounding it are the bands of proteins from the process of fibrosis. If we zoom out a bit and look at it with the naked eye, we'll again see these nodules, which have 5 product protein bands in between. Alright, but how do these bands of fibrotic tissues form through? Well, fibrosis is a process mediated by these special cells called stellate cells that sit between the sinusoid and the hepatocyte, known as the parasinusoidal space. Here's a pretty basic layout of the basic functional unit of the liver. You've got the portal vein in the hepatic artery that combined into the sinusoid, which then goes into the central vein, and these are aligned with the hepatocytes, right? Along this though, you've also got a bile duct. Also, since the liver plays a big role in metabolizing estrogen into inactive metabolites that can be removed from the blood and excreted. And usually in the healthy tissues, this guy's main function is to store vitamin A, and are otherwise considered quiescent or sort of dormant. When the hepatocytes are injured, so they secrete paracrine factors that activate and sort of change the stellate cells. When activated, the stellate cells lose vitamin A, proliferates and starts creating and transforming growth factors beta-1 or TGF-beta, which then causes them to produce collagen, which is the main ingredients in the extracellular matrix, fibrosis, and the scar tissues. As these byproduct tissues build up, it starts to compress the central veins in the sinusoids. It's thought that in healthy normal state, the stellate cells play key roles in the natural wound healing process. But when the liver cells are constantly injured, the stellate cells are constantly activated, and so they constantly produce collagens and factors that lead to fibrosis. And this is when complications due to cirrhosis start to crop up, as those central veins and the sinusoids become compressed and pushed on the fluids inside. This pressure starts to build up, leading to sinusoidal, or sometimes called the portal hypertension, which is the higher pressure in the portal veins. Higher portal vein pressure means that the fluid in the blood vessels is more likely to get pushed into the tissues and across tissues into the large open spaces like the peritoneal cavity. That's why cirrhosis leads to excess peritoneal fluids, conditions called ascites, and can result in the complications like congestive splenomegaly and hypersplenism, where the spleen becomes enlarged because all the fluids in the blood can't get into the liver and backs up into the spleen instead. In the same way, your circulatory system starts diverting blood away from the liver because of the high liver pressure. And this is known as the portosystemic shunt. And this happens because blood flow follows the path of least resistance and basically shunts away from the portal system and towards the systemic system of the circulations. Though not fully understood, these changes in the portal flow ultimately trigger renal vasoconstrictions. So increased resistance in the renal circulations, which decreases blood flow through the kidneys, leading to decreased filtration. And hepatorenal failure, where kidney failure follows the liver failure. A fibrotic tissue pressure buildup and diversion of blood from the hepatic circulations essentially reduces the number of functional sinusoidal veins and the number of functional portal triads in general. As you have less and less of these basic liver functional units, your liver becomes less and less able to do its job of detoxification. When the liver isn't detoxifying the blood, these toxins can get into the brain and start causing mental deficits, a condition known as the hepatic encephalopathy. Although there are several neurotoxins that are thought to contribute to the development of these mental changes, the best understood factors is ammonia in the blood. Usually, the liver plays a huge role in removing ammonia and stopping it from going into the systemic circulation. As the liver becomes more damaged, these and other toxins get into the brain, and the patients might develop asterexis, where they have tremoring or jerky hands when outstretched. And as even more toxins build up, eventually patients can progress to a coma. Also, since the liver plays a big role in metabolizing estrogen into inactive metabolites that can be removed from the blood and excreted, patients can also experience complications due to increased estrogens in the blood like gynecomastia, spider angiomata, and palmar erythemata. And since the liver usually conjugates bilirubin, there will be increased unconjugated bilirubin in the blood from a less functional liver, and that can lead to a jaundice. Another important job of the liver is producing albumin. So again, if the liver is not functioning right, you can have a decreased amount of albumin in the blood or hypoalbuminuria. Finally, the liver helps in making clotting factors or proteins that help coagulate your blood. So when you're not producing these coagulation factors, you can develop issues related to your ability to coagulate blood, which you need in order to stop blood loss or after an injury, right? So to recap, the general symptoms of cirrhosis, early on the small amount of scarring in fibrosis, we call it compensated cirrhosis, meaning that the liver can still do a lot of its job. In this case, somebody with cirrhosis may not have any symptoms, or they might have non-specific symptoms like weight loss, weakness, or fatigue. Later on, though with extensive scarring, the liver progresses to decompensated cirrhosis, and it can function normally. At this point, a lot of the described symptoms start to develop, like jaundice and pruritus or itchy skin, ascites or hepatic encephalopathy, which can lead to confusions and easy bruising from local regulation factors. For diagnosis, the gold standard is a liver biopsy, which is taking a tiny sample of the liver tissues and examining it under a microscope. The common lab findings include elevated serum bilirubin, as well as elevated liver enzymes like aspartate aminotransferase or AST and alanine aminotransferase or ALT, whereas AST is usually more elevated than ALT. Also, alkaline phosphatase or ALP and gamma glutamyl transpeptidase or GGT can also be elevated. And there might also be thrombocytopenia or low platelet counts. As a treatment, generally the scarring in the cirrhosis is irreversible. So first of all, it's important to prevent continued liver damage by identifying the underlying cause and treating that. For example, stopping alcohol consumptions or antiviral treatments for those with hepatitis C. With advanced cirrhosis, though where the liver stops functioning, a liver transplant might be needed.